going to talk about the EENT assessment. Now that includes eyes, ears, nose, mouth, and throat assessments. Now in terms of supplies, you're going to need an alcohol pad, an ophthalmoscope and otoscope, a tuning fork, a pen light, and a tongue blade. Now if you don't have access to the scopes, that's fine. You can use a pen light, and if you don't have a tuning fork, you can just skip those. So start with the eyes, and as always, we start with inspection. You want to look externally first. Are they symmetrical? Are the eyelids symmetrical? Is there any drooping? Do you see any drainage, redness, or lesions? Are they protruding or sunken in? You can use your thumbs to gently pull down on the lower eyelid and check the conjunctiva. They should be pink and moist, minimal clear drainage. And of course, make sure you look at the sclera. They should be white and smooth with minimal blood vessels. Now we can check vision and pupil function. So you can use a Snellen chart or other visual acuity chart, place it about 20 feet away from the patient, have them close one eye at a time and read the chart, just testing for visual acuity. If you don't have a Snellen chart, you could also have them read a sign on the wall across from the bed. After this, we're going to test for peripheral vision. Have the patient look directly at your nose, put your hands about a foot away from their head and a little behind, and start wiggling your fingers. Move your hands slowly forward and have the patient let you know when they can see the wiggling. Should be straight sideways, about 180 degrees. Now we can look at pupils and extraocular movements. This is the same test you see in the neurologic exam. So grab your pen light and shine it into each eye one at a time, looking for the pupils to constrict. They should be round, constrict briskly and equally on both sides. And make sure you check for accommodation, which is constricting on the opposite side of the light. Then you are going to have your patient follow your finger with just their eyes and test the 6 cardinal movements. The movements should be smooth and coordinated on both sides. Now you want to grab your ophthalmoscope, turn the light on, and check inside the eyes. You're looking at the retina and the optic disc, which is on the medial side. The retina should be orangey red with some blood vessels visible. You should also be able to see the red reflex when you shine the light towards the pupils. So now we're going to move on to the ears, and as always, we start with inspection externally. You want to look at the pinna. They should be symmetrical with no lesions or swelling. You also want to look at the external meatus, looking for drainage, redness, swelling, or any cerumen buildup. You can go ahead and palpate externally as well once you're done inspecting. The pinna should be smooth with no masses or tenderness. You also want to palpate the mastoid processes. They should be firm and non-tender. Now, before you start your internal exam, let's do the hearing tests. First test is the whisper test. Stand a few feet away from the patient and whisper a 2-syllable word and have them repeat it. My favorite is bacon. They usually get excited about that. Just make sure you repeat it on the other side with a different word, like cheesecake. Next, you're going to move on to the Weber and Rinne tests. For that, you need a tuning fork. The Weber test tests bone conduction for hearing. So strike the tuning fork and put it on the top of the patient's head. Ask the patient if it sounds the same on both sides. We want to know how well the sound moves through bone. Next, we'll do the Rinne test. Strike the tuning fork and place it on the mastoid process behind the ear. Have the patient let you know when they can't hear the sound anymore. Now, I always do this on my hand and not a table so that the sound doesn't go on forever. Once they say they can't hear it anymore, you're going to take the tuning fork and move it to right outside their ear without touching it, and again have them tell you when they can no longer hear the sound. This test compares air conduction and bone conduction. The second test, the air conduction, should last about twice as long as the first one, the bone conduction. Now, it's not about exact number of seconds. Just make sure your counting's consistent. Now, I want you to grab your otoscope and look inside the ears. For the adults, pull the pinna up and back. For kids, pull it back and down. Make sure your probe covers the right size and look inside the meatus. You're looking for any redness, swelling, discharge, maybe cerumen buildup. You also want to look at the eardrum. It should be pearly gray and translucent. Now, here's why we did that part last. We're actually going to hang onto the otoscope and move right into inspecting the inside of the nose. This is all about efficiency, guys. You want to look for discharge, hair distribution, and polyps. You also should look to see that the septum is midline and that the turbinates are beefy red. You can also use this time to quickly inspect inside the patient's mouth. Just look at the mucous membranes. They should be pink and moist with no lesions or ulcerations. Look for any white patches that could indicate thrush. Now you can put the otoscope away and inspect externally. The nose should be midline and symmetrical. The nares should be equal on both sides. Just make sure you make note of any deformities or lesions. You should also palpate the frontal and maxillary sinuses. Any tenderness there could indicate infection. Then we're quickly going to test function of the nose. Occlude one nostril at a time and have the patient sniff. This tests for patency. Then have them close their eyes and identify a common scent like an alcohol pad to make sure their smeller is working. Once you've done that, you can move on to the mouth and throat in more detail. This is where you'll need your pen light. First, inspect the outside of the lips, looking for any cracking or lesions. Look at the roof of their mouth. The hard palate should be hard and pink with ridges. Then have the patient say, ah. Their soft palate and uvula should rise midline when they do that. Look at their tongue and under their tongue. Should be midline, dark pink, no swelling or lesions. There shouldn't be any swelling in the salivary glands under the tongue. You also want to look at their teeth and gums. Is there any bleeding or plaque? Any teeth broken, loose, or missing? Do they have dentures when they bite down? Are their teeth in alignment? And then, of course, look at the back of their throat for any redness or swelling of the tonsils. Lastly, you're going to use your tongue blade to elicit a gag reflex to make sure the cranial nerves are intact and the patient should be able to safely swallow. I know they hate this part. Remember that any swelling in the throat, tongue, or tonsils could cause an aspiration or airway risk, so make sure you're aware if that's the case for your patient. Now that's it for the EENT assessment. I know it's a lot, but for each one, you're going to inspect externally and internally, palpate for any abnormalities, and assess function. There's a lot of images attached to this lesson to show you what certain things should look like, so make sure that you check those out. We hope that's helpful. Now go out and be your best selves today, guys, and as always, happy nursing.